objectives are clear, is to define pathology, explain historical development of pathology, enumerate founders of modern pathology, differentiate between clinical and experimental pathology, outline subdivisions of pathology, and describe techniques for studying pathology. So this is what we are going to go through for this afternoon. Okay. What then is pathology? When we say pathology, what at all is that word? Now, it is derived generally from two words. They are Greek words, okay, which is pathos and then logos. So pathos in Greek means suffering, and logos, as we all know, means the study of, or the study, meaning study. So essentially, we can say the study of suffering. Okay, that is how pathology emanated. Okay, so we have pathology today coming from this background. Okay, so we say pathology is a scientific study of the structure and function of body in disease. Notice this. In anatomy, you look at the structure, the study, scientific study of the structure. In physiology, you look at the scientific study of the function of that structure. In pathology, you are looking at the structure and the function, both of them in a diseased state. So when a structure is diseased, when a function of a structure is not functioning well, is in a diseased state, you are studying pathology. Okay, so that is essentially what we do. We usually say, sometimes in referring to them, we say pathophysiology. Okay, what it means is that you are studying the abnormal function of a structure or a body part. So, in other words, pathology consists of what? Abnormalities that occur in normal anatomy. So we look at the tissue, just as we looked at yesterday. So we can do histology. When you are doing histology, you are studying the tissues to understand if there are any abnormalities there. Okay, so that is pathology. So the layman will say you are studying diseases. You are studying diseases, or you are studying abnormalities of the body. Okay, so we say another commonly used term concerning the study of disease is pathophysiology. I've said. Okay, so physiology is the normal function, study of the normal function of the body, and then patho is suffering. So I mean suffering of the normal function of the body, like that. Okay, and that is pathology, and that is fundamentally why you are here, to understand disease conditions, and you move on to study how you can deal with them. Now, we are saying that pathology is a branch of medical science, and its focus is to aid in disease diagnosis. Okay, so the examination of cells, we examine tissues, organs, bodily fluids like blood, phlegm, and all of them. Okay, even we can go on to do autopsy. So you've been hearing that, oh, when this person died, the pathologist said, the pathologist is here to do the autopsy. The pathology. So sometimes you can even use cadaver, or through autopsies, you can effectively understand disease and then diagnose them. Now, modalities of pathology usually revolves around genetics. So you can look at genetic pathology. Some people can specialize in there. And I think in physiology, we'll be looking at that. Some people can specialize in genetics. Some can do molecular medicine. Okay, at the molecular level, at the chemical level, what is happening there? Some people can go into immunologic, immune function and all that. Gross microscopic examinations, all of them are modalities in which you can study pathology. Okay, so we say medical doctors who specialize in this branch of medical science are referred to as pathologists. Okay, after graduating as medical doctors, they specialize in pathology. So some can go into clinical, some can go into other areas. And those who go into clinical are those who refer to as lab technicians and all that. Okay, so pathology looks at every part of the body, every part of the body. Okay, so at broad areas of pathology groupings can include the gastroenterology. So look at all that aspect pertaining to your GIT or from away from your buccal cavity all the way to your stomach, your intestine, and all of that. You can even look at gynecology as pertaining to women. Okay, productive health of women and all that. You can look at blood diseases. Okay, you can focus on hematology, blood diseases. Okay, or microbiology, cancer such as lung, all of them. You can, pathology is simply broad. So all that we are going to do is to study the general pathology and then do the systemic pathology. And in your advanced levels, if you are interested in pathology, you can pick a path and then go, and then you'll be fine. So if we properly understand pathology, then almost 70% of our work is done as medical practitioners. Almost 70% of the work is done. Because to be able to understand properly what that disease is, will tell you how to approach it. Okay. We'll tell you how to approach it. I'm in trouble. My daughter is away from school. Okay. So you explain, let's go to the historical development of pathology. The historical development of pathology. Okay. So the prehistoric times, in prehistoric times, or before AD 1500, you know that health practically emerged from religious beliefs. Okay, before science became science, modern science as we see it now, health had practically been combined or intertwined with belief systems. So, sorry. So you go to India, okay, they have a deity called Dhanvantri. They see that deity as having the power over what? Medicine. So whenever they have challenges as pertaining to health or disease, they move in there and then they get the direction on what to do, and then they are able to go. When you go to the Greeks, okay, when you are studying Greek mythology, you are going to come across certain deities, okay, so Asclepius and then Apollo, okay, all of them are there, even Diana and all of them. These were considered essential in the treatment of diseases. That was when our knowledge in scientific field were very, very limited. Even when you go to ancient Israel, okay, you are going to realize that a lot of the belief systems, a lot of the health belief systems were intertwined, were actually part of the oracles that God gave to Israel. So you go through the books of Moses, a lot of even when it's nutritional the Lord and they follow and we all the results that we all ancient before prior to AD 1500, health and disease, the concept of health and disease were merged with religious beliefs. Okay, they were inseparable at that time. They were inseparable at that time. Okay, so that is how the nature of things were. Okay, that is how the nature of things were. Now, you come to a period that we migrated from religious beliefs and then magic to rational approach. Okay, and this is where most of the theories, from where I sit, we were migrating but got it all wrong. Okay, so we migrated from the belief systems, and then we went to rationalizing things. So traditionally, where the knowledge, source of knowledge were coming from, we used science to demystify them. We use science to really suppress. We use science to really decouple them. Okay, whilst some were purely religious in nature, some were actually grounded in scientific principles, and it is now we are getting to understand. Okay, so a time came, we decoupled it. Okay, we decoupled it all entirely, and then persons who were philosophers, okay, like Socrates, Plato, Aristotle, these all came with intellectual understanding, philosophical concepts to understand certain natural phenomena. Okay, they were good. Advancement in science is good, but the moment you try to rationalize it away from the main source, okay, or from the tradition from where it came from, then that is where problem comes. And most of this one, we lost a lot. It is today that most of the knowledge lost is now coming up. Okay, so we are in 460 to 370 BC, thereabout. Then we understand that Hippocrates, okay, brought onto the forefront the real practice of medicine. Okay, the real practice of medicine, we are told. But we know people have lived, even the time of Adam, until Hippocrates, people had lived. And some were diseased, they got healed through certain traditional practices. But they are telling us that Hippocrates brought it to the forefront. So we hear. Now, in ancient Egypt, ancient Rome, and Greece, okay, they all hold ancient history of pathology. So Celsus, who was a Roman, is said to have observed the clinical features on what is known in medical circles as inflammation. Okay, so anciently they were observant. Okay, ancient they were observant. They were very, very technical, these things. Okay, so Avenzoa, an Arabian physician, is credited with being the first person to perform postmortem, even before the dawn of Renaissance period. Okay, the first person known and documented is Avenzoa, okay, who was an Arabian physician. So during that time, he was able to perform a postmortem. But I mean, it is as it is. Okay, so that is how the period started. Pathology began, as we know. Okay, now after AD 1500, when we had entered properly into the Renaissance period, okay, then you know that the beginning of the development of human anatomy took place sorry, during this period, with the artworks and drawing of persons like Leonardo, that Italian painter. Okay, so These began, once he was able to paint to us the actual picture of a normal state of the human body. The dead people, he goes to dig them from their grave and then send it to this one, and then begins to cut and then show us how the diseased state of structures of the human body are. Okay, so Andreas Vesalius also began dissections. Okay, and then those who are criminals who have been executed, they have been hanged or killed or something. Once they are killed and they die, then Vesalius will go for the body and then start cutting, and then they can bring out this one. So one writer to Giovanni Mognani, okay, so he was in this train together. For him, his attention was on anatomy proper, pathology, looking at the structure in a disease state. Okay, so all these people came to play their role in the development of pathology. Then the era of gross pathology had three more illustrious and brilliant physicians. You can talk of Richard Bright, okay, who described non-suppurative nephritis, okay, or as later called glomerulonephritis. Okay, so inflammation in the nephrons. We'll look at that next semester. Sometimes you can get the nephrons in the kidneys, inflaming, leading to foamy urine and this one, and then they'll come and tell you your kidneys failing and all that. So you come to understand. Thomas Addison, Addison's disease, he brought the concept of adrenocortical insufficiency, or what you call Addison's disease, when the person has moon face and all that. Okay, then Thomas Hodgkin's disease, we look at endocrine systemic, this one, endocrine pathology. You look at some of these conditions as pertaining to a lot of the endocrine glands. Okay, now let's look at clinical and experimental pathology. I don't know if at this point there's any question for me before I continue. All right. So we are going to look at pathology, clinical and experimental. But let's first look at clinical pathology, because that is what you and me, our interest is. We are saying that it's a medical specialty that is concerned with the diagnosis of diseases based on the laboratory analysis of bodily fluids, okay, such as blood, urine, and tissue homogenate or extract, something they do through biopsy. Okay, so clinical pathology, we are going to diagnose a disease through lab analysis. Okay, so any of the bodily fluids or compositions. Okay, so it usually utilizes the tools of chemistry, microbiology, hematology, and molecular pathology. Okay, so clinical pathology found its feet within the contemporary era when sophisticated tools were invented. So this is clinical pathology. You being able to study disease or understand disease or diagnose disease when you make use of lab analysis. Okay, you make use of lab analysis, even when all indications suggest that you are hitting there. You just have to confirm to rule out any differential. Okay, so that's clinical pathology. So we also know that laboratory medicine. So it plays an integral role in the onset of disease. Today is very, very advanced. Today, the knowledge is well advanced, so much so that they can even predict the disease condition you are going to get, even when you are in the womb. Okay. And when you try to dispute it, you may be in trouble. So the primary role of clinical pathologists is to examine and identify abnormalities in cells and tissues of bodily fluids and other discharges. Okay, so that's their role. That's their role of clinical pathology. Now let's move to experimental pathology. As the name suggests, experimental pathology. So with experimental pathology, you are known as what? Investigative pathology. So it involves all the processes through which the microscope or molecular examinations of organs are done. Okay, molecular examination of tissues and all of them. Okay, so you do that to investigate. Okay, and like epidemiological departments do. Theirs is to investigate to understand why things are happening that way. Okay, so as clinical is you have a disease, I want to confirm what it is. So I send it to the lab. They give me the results. I interpret. Experimental, they are trying to observe. They are trying to put things together at the lab. Why this like this? Why is this way? Why is this? Why is this like that? Okay, that's experimental pathology. Experimental pathology, and those who would want to go into research and go and work at Noguchi. This is your area. Okay. Then after that, we are going to look at some of the divisions of pathology. Okay, some of the divisions of pathology. Now, we have anatomical pathology. Anatomical pathology. And anatomical pathology, we are looking at body compositions that we can take and observe. Okay, and it is largely done through autopsies when the person is dead. Okay, so we can investigate and diagnose a lot of things, and this is what we usually do. When the person dies, go and cut and then try and then understand what actually happened and all of that. These are anatomical pathologies. Okay, because at that state, the body is not functioning anymore. Everything has ceased. Okay, everything has ceased. So they are the only going to understand anatomically what has happened. Okay, so it says we consider them under gross anatomical makeup of the sample. Okay, so grossly by looking at it, what's the anatomical makeup from comparing them to the normal? What's the anatomical makeup? What is the shape? What is the size? Has the size reduced? Has it become bigger? Has it done this? Has it done this? And all of them. Okay. Then we look at microscopic appearance of cells. And a microscope, we study the cells. Are they okay? Have there been any hypertrophy? Have there been any hyperplasia and all that's in there? So they study them under microscope to do. And then chemical signatures. Sometimes you have to look at chemical signatures. You have to consider a lot of things on microscope. So we insert it under microscope and then observe. Are there any chemical signatures? So at the molecular level, what is happening? Are there this one? What is so all of them come in that we can do. Then immunological markers present in the cell, we can observe them and give us a clue of what the person was battling with before the person died. And the molecular biology of cells, organs, tissue, and all this. So we can go into anatomical pathology just to understand the changes that have happened to that structure, either the cell, either the tissue, either the organ, or even go deeper to chemical level. Okay, you can do that in anatomical pathology. Now, anatomical pathology, we can further classify them further into surgical and then histopathology. So surgical pathology, it involves what the examination of specimens obtained during surgery, such as breast lump biopsy obtained during mastectomy. So when a lady, I mean, you are suspecting of you are suspecting breast cancer, you take a sample, a biopsy to the lab, and then they observe and see. Okay, so these things fall under surgical pathology. Then we have histopathology, which refers to examination of cells under a microscope after they have been stained with appropriate dyes. Okay, where we see we can really analyze a lot of disease conditions histologically. Okay. Now, we can also look at cytopathology, as the name suggests, cyto cells. So you go deeper into the cells. Okay, you go deeper into the cells to understand, okay, and it is this, I mean, this division that we are able to come out with these blood groupings and all this. Okay, first you do, and then you observe how the specimens, the blood specimens react with the chemicals that are applied to them. Okay, so cervical smears and all that. Okay, pap smears, all of them go into cytopathology. You can even look at forensic pathology too. Okay, so we examine the corpses after death. I mean, to ascertain whether someone or somehow was able to get in touch with the patient before the person died, whether the person was strangled, it was through strangulation or something like that. So these are all forensic pathology that they do. Then dermatopathology, as the name suggests, they are into skin and all skin diseases. Okay, so they do their further studies in there. Okay, that is anatomical pathology. Now let's look at clinical pathology. Some of the divisions of clinical pathology as we first looked at. So for clinical pathology, if you talk about it, bodily fluids that is used in the study of what disease conditions. You can have the chemical level, chemical pathology. Chemical pathology, you take blood or urine or anything and then go and do an analysis. Okay, go and do analysis at the chemical level, to understand. Sometimes you want to know whether your the platelet aggregation, cytokines, are they playing their role well? So you want to know all these things. Which one is not up to the number that is normal? Which one is more than, well, what does it suggest, and all that? So these are chemical pathology. You can also do immunopathology. Okay, by looking at immunodeficiencies. So there are a lot of immunodeficiencies, and then immune hypersensitivities and all of them. So you look at all of them under immunopathologies, and that is where we are able to tell someone that, look, although everybody eats mango, or everybody eats orange, or everybody eats whatever rice, for you in particular, your body does not understand, okay, this particular composition in this food, and that is how come when you eat you get a reaction. Okay, you get reaction. Some people will drink milk even after 4 years, they will feel okay. Some will drink milk after 4 years, they'll have problems. Okay, so I mean, these are some of the ways that we are able to know is through immunopathology. Okay. Then we have hemopathology, hem signifying blood. So we look at blood and blood conditions. Okay, blood and blood pathologies. So all of them, a lot of them. We'll have time to look at some of them. Okay. We have molecular pathology, as the name suggests, molecule at the molecular level. That is where the genetics come in, DNA, the histones, and this one, they come in there are the organelles. Okay, at the molecular level, when you enter the cell and go into the cell, the organelles in there. Okay, and then the nucleus, the DNA. So sometimes they can be problematic. Okay, and by understanding molecular pathology in a lot of things, you can better be able to comprehend or understand the disease conditions. Why is diabetes there? Why is diabetes there? Okay, so understand that diabetes goes beyond all that we know. You have to enter into the cell and go to that molecular organelle called mitochondria and know that there's a problem with the mitochondria. Okay, so this makes you understand what these disease conditions are. And when you are giving your medication, you don't give it like that. You know that in your mind it has to enter the cell and perform this function and all of that. Okay, that is how can we do molecular pathology. Well, pathology we are studying, because we are not studying them in divisions, for some conditions you'll be looking at them in detail, and then all these things may come in. Okay, all these things may come in. Okay, so what else should we look at? Technique for studying pathology. Just as it is for anatomy and physiology, you have to read before you come to class. That is very true. You have to read before you come to class. Then show up to class and take good notes. Okay, that is also there. You have to learn to memorize definitions. Memorize definitions. Okay, pathology is not as simple as we know, but with consistency, once we learn, it will go well. Okay, so all the difference we did for anatomy surgery, that's for pathology. I'm done with the lecture for today. Any question? Yes, if there's any question, it can come.
Yes, sir.
Yeah.
Please, I
Any
want to ask something. In learning this, are we going to learn it by taking it body part by body part in the form of anatomy? That's the anatomical physiology. Because if it's the study of the it's the study of the it's the study of how do you call it, diseases. Are we going to take it body part by body part with their or abnormal conditions?
Okay. So this is how a pathology is going to go. There are two parts. So we have pathology 1 and pathology 2. Pathology 1, pathology 1 considers general pathology. And let me explain general pathology. General pathology will look at conditions that can occur or happen in every structure of the body. So, for example, say inflammation, we'll be looking at that very soon. When we say inflammation, inflammation can occur in the heart, inflammation can occur in the lung, inflammation can occur in the brain, every part of the body, your knee, every part. So, we study the nature of inflammation. That is general pathology. That is what we are doing under pathology 1. When we are done with pathology 1, we are going to move to pathology 2. And pathology 2 will look at systemic pathology. So systemic pathology, we will take it system by system. So when we take, for example, the digestive system, we are going to look at the esophagus, problems associated with the esophagus. We are going to look at the stomach, diseases of the stomach. We are going to look at the duodenum and the colons, diseases that are associated with them. The rectum and then the anus, diseases that can occur to them, and the accessory organs like the liver, pancreas, and the gallbladders. When we are done with the digestive system, we shall move to cardiovascular, we move to endocrine, we move to respiration. So that is how we are going to take. So under the systemic pathology, we take the system, take it structure by structure. What can happen to that? If it is infectious disease that is happening in the lungs, what is it? What is its nature? What is its clinical presentation? If it is inflammation happening in the lungs, what is it? And symptoms that the patient will present to you. So that is how it is structured. Okay, that is how it is structured. And by the time you are done in pathology too, if we are consistent, you will get everything on point. I hope I've been able to say something. Okay, so let's move to Mr. Olum,
Olumide.
aha, that is it.
Olumide, thank you. Um, thank you. Like, what should I call you? Professor, lecturer, sir. Um,
I
okay. I would like for you to comment on the clinical pathology. You mentioned experimental as well as an investigation. Would we, during when we